Morning everyone. Today we will see some pediatrics exam questions. Some pediatrics exam questions for COC students. Here are 30 pediatric nursing case-based questions along with answer and brief descriptions for hypothetical COC or certificates of competence exams. These questions are used for all students or nursing students based on the COC exams. So please follow all questions and share for your friends. Question number 1. Case respiratory distresses. A 2-year-old presents with respiratory distresses. What is a priority nursing action? The action. What is a nurse? The person who are doing as a nurses have doing on these areas. So choice A, administer antibiotics. Choice B, assess a vital sign. Choice C, obtain a urine sample. Choice D, administer an antibiotics. The answer for this question, or the best answer, is assessing the vital signs. Assessing a vital sign is crucial to determine the varieties of respiratory distresses and guide further interventions. So for this question, choice B is the best answer. Question number 2. Case immunization schedule. Question number 2. A parent asks about the immunization schedule for their 6-month-oldest. What vaccine is recommended? Which means that for infant childs, there are different types of vaccines. Which types of vaccines are used for this 6 months child or old infant? Choice A, MMR. Choice B, hepatitis B. Choice C, varicella. Choice D, DTaP. So those options are, there are different types of vaccine medicine what we are take for different ages of the old people. So for this 6 months old child, we should be take DTaP. Choice D is the best answer. DTaP vaccine protecting against diphtheria, tetanus, and pertussis is recommended at 6 months age. 6 months age. Question number 3. Hydration assessments. A 6-year-old is admitted with suspected dehydration. What findings suggests severe dehydration? Choice A, dry mucous membrane. Choice B, capillary refill less than 2 seconds. Choice C, increased urine output. Choice D, normal fontanelle tensions. The answer is choice A, dry mucous membrane. Dry mucous membranes are indicative of severe dehydration or the sign of this dehydration and required immediate interventions. So for dehydration, the sign of dehydration is dry mucous membrane. The answer is choice A. Question number 4 is developmental milestones. A nurse is assessing a 1-5 months old for developmental milestone milestone. What is an expectation? Expect milestones. So the question is, for us, a nurse is assessing a 5 months old. So choice A, walk independently. Choice B, use fork and spoon. Choice C, speak in short sentences. Choice D, ride a tricycle. So the answer for this one is choice A, walk independently. Walk independently is an expected developmental milestone around 12 to 15 months. 12 to 15 months. It is recommended. Question number 5. February surgery. A 2-year-old has a February surgery. What action should the nurse take during the surgery? A. Administer antibiotics. B. Place the child on their side. Choice C. Restrain the child. Choice D. Offer a padded tongue process. Choice B is the correct answer. Place the child on their side. Placing the child on their side helps maintain a clear airway during a surgery. Question number 6. Question number 6. Gastroenteritis management. A child is diagnosed with a gastroenteritis. What nurse interventions help prevent a dehydration? A. Limit liquid intake. B. Administer anti-emetics medication. Choice C. Provide small frequent feeding. Choice D. Encourage a clean liquid diet. The answer is choice C. Provide small frequent feeding for dehydration. Small frequent feeding helps maintain dehydration in gastroenteritis. Question number 7. Besides that, pediatric medication administration. The nurse is administering amoxicillin to 5 years old. How should the nurses administer the medication? This medication should be taken for the 5 years old, or the mechanisms what we are using for taking this medicine for this all 5 years old persons or child. So choice A, crush the tablets and mix with juice. This is one mechanism. Choice B, administer on an empty stomach. Choice C, take with milk or food. Choice D, skip the dose if the child feels better. So for these mechanisms, choice C is the best answer. Take with milk or food for children when we are taking the medicine. For the children, we should take that dozen with other food or other intake liquids. So amoxicillin should be taken with food to enhance absorption and minimize the gastric irritations. Question number 8. Asthma action plan. A child with asthma is prescribed a peak flow methods. What is the purpose of the peak flow methods? A. Measure oxygen saturation. Choice B. Assess lung sound. Choice D. C. Evaluate response to bronchodilators. Choice D. Monitor heart rates. The answer is choice C. Evaluate response to bronchodilators. The peak flow methods help us assess the effectiveness of bronchodilators. therapy in managing asthma. Question number 9. Several allergic reactions. A child develops several allergic reactions. What is the initial interventions? Choice A, administer an antihistamine. Choice B, apply cold compress. Choice C, administer epinephrine. Choice D, encourage oral fluid. Choice C is the best answer. Epinephrine is the first line treatment for severe allergic reactions. Question number 10. Case pediatric pain management. How we are managing pain? A child is post-operative and reports pain. Post-operative and reports pain. What is the most appropriate pain assessment tools for preschool age child? At this age, maybe this child is not taught. So, by what mechanism we are detect this pain? Choice A, numeric rating scale. Choice B, visual analog scale. Choice C, work break phases pain rate scale. Choice D, FLAC or FLACC scale. Choice D is the best answer. The FLAC scale is commonly used for pain assessments in non-verbal or pre-verbal children. Question number 11. Pediatric infectious disease. A child is diagnosed with chickenpox. What precaution should the nurse implement? Choice A, standard precaution. Choice B, airborne precaution. Choice C, droplet precaution. Choice D, contact precautions. The answer is standard precautions. Choice A is the best answer. Chickenpox is spread through respiratory droplets and requires standard precautions. Question number 12 says that case pediatric neurological assessments. The nurse is assessing a 2-month-old for sign of increased intracranial pressures. What findings should be reported immediately? A, fontanelle bulging. B, positive Babinsk reflexes. C, absence of Moro reflex. D, jerk or uncoordinated movements. The answer is fontanelle bulging. Fontanelle bulging is a sign of increased intracranial pressures and records prompt interventions. Question 1.3. Pediatric cardiac assessments. The nurse is assessing a newborn for sign of congenital heart disease. What finding indicates type of heart defects? A, murmurs on auscultations. B, presence of acquiescence. C, equal pulse in all extremities. D, bilateral synchronous lung sound. The answer is choice A. Question 1.4. Pediatric fluid and electrolyte imbalance. A child is admitted with vomiting and diarrhea. What electrolyte imbalance is a child at risk for? A. Hyperkalemia. B. Hypokalemia. C. Hyponatremia. D. Hypernatremia. The answer is choice C. Hyponatremia. Vomiting and diarrhea can lead to sodium losses, resulting in hyponatremia. Question 1.5. Is pediatric diabetic ketoacidosis. A child with diabetes presents with fluid breaths, lethargy, and rapid breathing. What is the priority actions? A. Administer insulin. B. Administer intravenous fluid. C. Provide a high carbohydrate snack. D. Assess blood glucose level. The answer is B. Administer intravenous fluid. Intravenous fluid are essential to correct dehydration in diabetic ketoacidosis. One takes question number 16. Pediatric renal assessment. A child with nephrotic syndrome is at risk for edema. What dietary modification is recommended? A. Low protein diet. B. Low sodium diet. C. High potassium diet. D. Low fluid diet. The answer is low sodium diet, or choice B. A low sodium diet helps managing fluid retention in nephrotic syndromes. For that case, choice B is the best answer. Question 1.7. Pediatric musculoskeletal injuries. A child sustained a forearm fracture. What is appropriate nursing action during cast care? Keep casts uncovered for ventilation. B. Use heating pad to relieve itching, scratching. C. Elevate the extremity on pillow. D. Insert object inside the cast for stretching. Choice C is the best answer. Elevate the extremity on pillow. Elevates help reduce the swelling and promote comfort in child with a cast. Question 1.8. Pediatric communicable disease prevention. A group of preschoolers is play together. What interventions promotes prevention of communicable disease? A. Sharing person items. B. Frequent hand washing. C. Eating from shared table plates. D. Avoiding immunization. B. The correct answer. Frequent hand washing. Hand washing is a key measure to prevent the spread of communicable disease. For minimizing the ways of spreading communicable disease, we should be washing our hands frequently. Question 9. Case: a pediatric respiratory infection. A child is diagnosed with bronchiolitis with intervention. Should the nurse prioritize? A. Administer bronchiolitis. B. Initiate contact precaution. C. Administer antibiotics. D. Administer antibiotics. The answer is A. Administer bronchodilators. This mechanism is often caused by a vital infection, and bronchodilators may help relieve the symptoms. Question 20. It's also case a pediatric neurology dysfunction. A child with head injury is at risk for increased intracranial pressures. What nurses interventions is crucial? A. Encourage a vigorous play to enhance motor skill. B. Administer sedatives to promote rest. C. Maintain a quick environment. D. Limit liquid intake to prevent swelling. Choice C is the best answer. Maintaining a quick environment. Minimizing stimuli helps reduce the risk of increased intracranial pressures in a child with head injuries. So answer is C. Question 21. Also case a pediatric hematology disorder. A child is diagnosed with iron deficiency anemia. What dietary recommendation should the nurse provide? A. Limit red meat consumption. B. Increase dairy product. C. Encourage a vegetarian diet. D. Include iron-rich food. The answer is D. Include iron-rich food. Iron-rich food helps address iron deficiency anemia. For increasing iron in our bodies, we should take iron-rich foods. Question 22. A pediatric emergency situation. A child is found unconscious. What is the initial action? A. Administer restore breath. B. Check for a pulse. C. Call for emergency access. D. Elevate the legs. Answer: call for emergency access. Initiating emergency access is the first step in managing an unconscious child. For unconscious child, we should be taking emergency assessments. Question 23. Pediatric mental health assessments. A teenager exhibits a sign of depression. What is the priority nursing action? A. Encourage isolation for self-reflection. B. Assess for physical identification. C. Provide constant praise and attention. D. Administer sedative. The answer is choice B. Assessing for accidental identification. is crucial in addressing the depression. For addressing the depression, we should be take choice B. Question 24. It also case pediatric infection disease. A child is diagnosed with tuberculosis or TB. What precaution is necessary during hospitalization? A. Airborne precaution. B. Contact precaution. C. Droplet precaution. D. Standard precautions. The precaution for tuberculosis is airborne precautions because tuberculosis diseases are transmitted through air. TB transmitted through the airborne regions during airborne precautions. So choice A is the best answer for this question. Question 25. Pediatric genetic disorder. A child is diagnosed with cystic fibrosis. What is the key components of the nurse can plan? A. Encourage high-fat diet. B. Administer bronchodilators. C. Promote a low sodium diet. D. Facilitate chest size physiotherapy. Choice D is the best answer. Facility chest physiotherapy is the best answer. Chest physiotherapy helps managing respiratory systems in cystic fibers. Question 26. It is also case pediatric endocrine disorder. A child is diagnosed with hypothyroidism. What priority nursing intervention? A. Administer thyroid hormone replacement. B. Restrict fluid intake. C. Monitor for sign of hypothyroidism. D. Encourage low fever. Yes, A is the best answer. Administer thyroid hormone replacements. Administering thyroid hormone replacements, the ways of replacing the thyroid hormone, is crucial in managing hypothyroidism. Hypothyroidism is type of disease. For managing this, we should be replacing thyroid hormone. Question 27. Pediatric gastrointestinal disorder. A child is diagnosed with celiac disease. What dietary recommendations should be nurse provide? A. Increase gluten containing food. B. Avoid food containing gluten. C. Limit protein intake. D. Encourage high fiber diets. The answer is choice B. Avoid foods containing gluten. Celiac disease requires a gluten-free diet. So, for minimizing this disease, we should minimize gluten intake to prevent gastrointestinal symptoms. Question 28. Pediatric respiratory assessment. A child is admitted with acute asthma exacerbation. What assessment finding indicates respiratory distress? A. Oxygen saturation. of 98%. B. Respiratory rate of 8 breaths per minute. C. Wheezing on expiration. D. Chest pain on inspiration. The answer is C. Wheezing on expiration. Wheezing on expiration is sign of airway or out air, constriction and respiratory distress in asthma. Question 29 or 29. Pediatric penile dysfunction. A child is diagnosed with acute glomerular nephritis. What dietary modification is recommended? A. Low sodium diet. B. High protein diet. C. Fluid restriction. D. Low potassium diet. Answer is A. Low sodium diet. Low sodium diet helps manage fluid retentions in acute glomerular. So the best answer is choice A. Low sodium diet. The last questions or question 130. Question 13. Last question. Pediatric surgical procedures. A. A child is scheduled for an appendectomy. What nurse action is essential in the post-operative period? A. Encourage coughing and deep breathing. B. Place the child in a prone position. C. Administer laxative to promote bowel movements. D. Restrict fluid intake. The answer is A. For this case, encourage coughing and deep breathing. Encouraging coughing and deep breathing helps or prevent respiratory complications after appendectomy. So the last question is this one. Thank you for watching. Please, if this video is best for you, subscribe my channel for the next videos and share for your friends. Thank you so much. Have a nice day. Bye.